Hey guys, so for this week's discussion, Living with Lung Cancer, we were asked to watch a video and then create a discussion video ourselves that addresses the issues faced by individuals diagnosed with lung cancer. What treatments are available? What is the prognosis for those individuals with lung cancer? And so living with lung cancer affects people physically, emotionally, and socially. One of the biggest challenges that patients face with lung cancer often is that it's diagnosed at too late of a stage. This is because symptoms might not appear at all, or if you're like me, you possibly had symptoms and you just you chose to not go to the doctor until it was too late. Well, then you have bigger problems. So things like this can lead to fear, uncertainty, financial stress. We all know, obviously, cancer treatments, etc. Honestly, anything within the healthcare medical field is just outrageously costly. So anyway, and just major lifestyle changes. So many people also experience stigma, judgment, especially if the cancer is associated, with smoking. And so things like that can affect their mental health and support systems as well. Available treatments for lung cancer. Treatments basically depend on the type and the stage of lung cancer, but most common options include surgery. This is used in early stage to remove things like tumors. Then you have radiation therapy, which uses high energy rays to kill cancer cells. Chemotherapy, drugs that destroy or slow cancer growth. You have targeted therapy, which focuses on specific genetic mutations in cancer cells. And then immunotherapy, which helps the immune system recognize and fight cancer. Newer treatments like the immunotherapy and targeted therapies have improved outcomes, and they continue to evolve also. The prognosis for lung cancer varies widely depending on how early, like we talked about, that it's diagnosed and the type of cancer that it is. Overall, it says in about 1 in 5 people survive 5 years after diagnosis. And if caught early, localized, survival can be as high as 67%. If it has spread, which is the distant stage, survival drops to be around 12% or even lower than that. And small lung cancer tends to be more aggressive and has lower survival rate than non-small cell lung cancer, which I thought was very interesting. It's also important to remember that these are all averages, and so individual outcomes can vary based on basically age, overall health, and how well that the cancer responds to the treatment. And so living with lung cancer is not just about the disease itself, it's about coping with emotional stress, treatment side effects, and even the lifestyle changes. And early detection plays a huge role in the survival and advancements in treatment and are improving outcomes. Support systems, education, and also access to care is very critical in helping patients navigate through the journey. I've never experienced having anyone with lung cancer, but my grandmother had breast cancer, and I'm so sorry, my baby. It was very devastating. It was, still to this day, like I was 16 at the time, but it was a lot, and I don't wish cancer, any kind of any sort, on anybody. But yeah, that's all I got. Thank you.